your experience in terms of using lasers for hair removal and stuff like that? Who's a good candidate?
So lasers are super effective for long-term hair reduction, hair removal. Who's a good candidate? Basically anybody, any skin type, as long as the hair is pigmented enough. So we do need to have some melanin in the hair shaft to be able to absorb the energy from the laser to make it effective.
What does that mean? So you're saying that you can't laser the white hairs on?
Correct. No white hairs, sometimes blonde hairs, like my hair is probably a little too light. So certain areas on me don't really work, but as long as it's like at least a little bit brown, we can figure out a wavelength that will absorb that energy.
And then do these lasers work on all type of hair parts? Like, does it work on hair from my scalp or hair from my beard, my eyebrows? Like, what?
Yeah, I mean, it would work on all areas. We probably typically wouldn't treat like your scalp or anything with that. But yeah, as long as it's pigmented, we would be able to treat it. There are certain areas that are more affected by hormones. So facial hair typically takes a little bit longer to respond. Sometimes certain areas like Brazilian can be a little bit more tricky, but yeah.
Okay, and then in terms of hormones that you brought up, right? And so a lot of people say that they have a lot of hair growth with hormone replacement. Like, does this help that or not?
Yeah, definitely. If you're on hormones and things like that, that's something we want to take into consideration when we're thinking about how many sessions you might need, because you might need more sessions if that's something that's going to be ongoing.
All right, so you use this word sessions. Like, what does this mean? Like, how long are they? Is there anything that tells me that should be more of them or less of them? What's the story?
So a lot of that depends on the body part that we're treating. That also has a lot to do with the length of the session. Say for like upper lip, that might be like a 5-minute quick little treatment. If we're doing like full legs, that's going to be probably over an hour or so, depending, what body part.
Yeah, so that's the time limit for each of the sessions.
For each
right?
session, correct.
And then how many sessions does it take? Right, for like, let's say I want to do my arm, like, what would that take?
We would typically start with 6 sessions for your arms and then kind of see where we're at from there. Sometimes maintenance treatments would be required, but typically after you've already gotten a really good result, that would last for like a year or so.
Okay, so the results last about a year, right? And then is that same for like hormone replacement patients, or is it different, or?
It would depend if you're still taking the hormones, then no, it would probably would need more sessions or more frequent sessions.
Yeah, so I think you kind of customize that depending on what their hormone levels are, and then kind of what area we're treating, how big and how large and all that stuff is.
Right, exactly.
Okay, and then in terms of, does it hurt?
Not bad. If you've ever waxed before, I think it's a lot more comfortable than that personally. To me, it kind of feels like you're plucking out the hairs individually. So it's not really what you would expect a laser to feel like. It shouldn't feel hot or anything like that. There's a few different ways that we cool the surface of the skin to keep it really comfortable. So it kind of feels like little rubber band snaps.
Rubber band snaps. And so is there numbing involved in this, or?
There can be. We typically don't need to for it to be relatively comfortable.
Okay, and so sensitive areas you tend to numb for, but then
we can, say for like upper lip or something like that. Any time we're treating anything for the upper lip, it might make your eyes water a little bit. So if we want to put some numbing cream on there for 15 minutes before, so we can definitely do that.
Yeah, and then how about armpits, right? Because that sometimes can be sensitive for people.
Super comfortable. I think armpits are fine. Okay. And fast too. Underarms might take like 5 minutes total.
Okay, and then is there anything I have to avoid before having these types of treatments for laser hair?
So before, we definitely don't want to wax, pluck, no epilators, no removing those hair follicles, because we need those intact to be able to kill them. But we do need you to shave prior to your treatment. So the closer the shaves, the better. It's going to be more comfortable and more effective because the energy doesn't have to travel as far to get to the follicle. So less painful because there's nothing on the surface snapping, burning as much, and then more effective because it's closer.
And then, so you said you shave how many days before, or the day of, or?
Typically I would recommend like maybe the night before.
Okay.
That gives your skin time to calm down, any irritation to go away from shaving, but generally the closer the shave, the better. So yeah, like the day before, morning of is okay if you can be gentle and not cause irritation.
And then in terms of those follicles, you said do anything to disturb those things. Like, how long do you preventatively do that before treatment?
Which part?
Or not do that?
Oh, so at least like 6 weeks. So we need the hair to be basically in the active growth phase to be able to effectively treat it. So we wouldn't want to remove it anytime within that 6 week period.
Okay, and so that's the before, right?
Yeah.
And then during, you said it's pretty close to painless in terms of these areas, the ones that are more sensitive or something, you're putting some numbing on. And then it can take anywhere from 5 minutes to an hour per area, all right, to do this. And then you said there's multiple sessions of this. Are between these sessions and things are there things that I can improve the results with?
So as far as like aftercare, just staying out of the sun as much as possible. Basically, the lighter your skin can be, the more aggressive we can be with the laser. So it does work on all skin types, but I would avoid sun exposure as much as possible, or wear SPF if you're going to be out in the sun for a long period of time. We also wouldn't be able to treat if you come in with a sunburn or non-intact skin of any kind. So, yeah.
So non-intact skin. So what does that mean? Does it mean like if I have a cut or if I have a wound?
Yeah, I would just go around those areas. We wouldn't want to treat over any like open skin or peeling skin. Even if you've had a sunburn and it's peeling, we would avoid areas like that. But back to the afterwards, sorry. Afterwards, we would want you to avoid anything like sweaty, don't go work out right afterwards, avoid anything harsh or irritating on the skin, so no scrubs or anything peeling, exfoliating, that type of thing. Just keep your skin really cool and dry for at least 24 hours afterwards. Worst case scenario, if you did get a little sweaty, I know it's in Texas, so it's walking to your car, you might get a little bit sweaty. We just want you to kind of wipe off the skin, get that sweat off your skin as soon as possible.
Okay, and then, some patients have acne and stuff at the same time with this. Does this affect it at all? Does it make it a higher likelihood of, some people get a folliculitis or something like that from where the hair follicles fall out? Like, is there things that you can do to prevent it?
Long term, that would actually improve if you're prone to like ingrown hairs and things like that. If there's no follicle, if there's no hair growing there, you're not going to get ingrown hairs anymore. So that's really nice. People that are prone to it, I probably wouldn't treat right over something that's like inflamed, or if it's angry, I'm not going to go right over it with the laser. But long term, that would help improve any of those conditions. As far as just like being prone to acne in general, that's probably not going to really affect it at all.
Okay, awesome. And then in terms of, probably people want to know, it's like, hey, is there a price range, like it's going to cost me to do this or what, or like what is there a range?
Off the top of my head, I don't know exactly what that price point would be. I don't know. I'm sure we can put that in the comments below or something like that. I'll hand that off to Taylor. But it's more of an investment up front, but it's a lot longer lasting than saying like waxing forever and ever.
Right. So in terms of cost analysis, right? People use all these different shavers or blades and stuff like that. You're not having to do that versus using these treatments, and then you're also not having to maintain anything on your end, but you're able to just get these sessions done and be hairless in those areas.
Right.
Yeah.
Yeah.
Okay.
It's life changing.
There you go.
Yeah.
All right. I'll see.
Any other questions?
We have some questions. Tim on TikTok wanted to know, what is the difference between the laser hair removal machine you have and the laser hair removal machines that they sell for at-home use?
Okay, so for at-home use, those are gonna not be very high power, probably not put off a lot of energy. If it's something that's safer at home, like these machines come with pretty big plugs, they pull a lot of energy. So anything that you're using for like at-home use is probably not really going to effectively target that follicle as well. I've never heard of one of those devices really being effective. I don't know if you.
Yeah, I mean, the thing is like it's much slower because you can't get the energy. It's not medical grade, right? So there's way more sessions, and it takes a lot more time in terms of getting any of these things done.
Awesome. Gabby wanted to know, she said that she's heard people say that sometimes after laser hair removal, the hair goes back thicker and darker. Is that true, or why does that happen?
I've never heard of it going back thicker and darker. Typically, the hair gets finer with each session. You'll see it fall out typically like 10 to 14 days after your treatment. And then after all the hairs fall out that have been treated, it grows back a lot finer, a lot slower. And hopefully you're having to shave less often in between sessions.
Yeah, I agree with that.
Awesome. Our next question was kind of similar. It's, does the hair fall out immediately after the treatment?
It takes a little bit of time. So I've had patients be like, it didn't work. My hair is coming back like normal. Like, be patient. Give it about 2 weeks or so. You should see the hairs kind of shedding. Even if you don't notice it physically falling out, you'll see the hairs a lot finer. over time. And you can continue shaving throughout that entire process. You don't have to like wait for it all to fall out. If you keep shaving, you might not notice that shedding process, which is fine. But yeah, it does take a little bit of time.
Yeah, I mean, I think the other thing is like the hair is in different growth phases, right? And so when you're targeting them with these lasers and these devices, you're only hitting one of those
Percentage at a
a
time.
big percentage at a time. So that's why the sessions being spaced out equally also gets them in different stages that then eliminates it over time.
Right.
Cool. Carol was asking, what are the most common side effects or risks?
Afterwards, you might have a little bit of bumpiness, irritation. Sometimes it looks like you have little red dots in each follicle, which is normal. That inflammation typically goes down like within a couple hours or so. Sometimes by the time you walk out of here, it's already gone. But that'd be like the number one side effect. Sometimes a little bit of itching, especially if you get sweaty, but we can give you some hydrocortisone or something to put on there. The more you stay cool and dry, the less likely you are to have any side effects after it.
Absolutely.
Awesome. Somebody was asking, what's the difference between laser hair removal and IPL?
So IPL is intense pulse light, and it can target hair follicles a little bit. It's not really intended for like hair removal, but that's kind of a nice side effect of it if you're doing it like on your face. It can kind of help with fine hairs and things like that. But laser hair removal is safe on all skin types, whereas IPL is only safe on skin types like 1 through 3. But yeah.
Yeah, I think there's just a difference between the machines in terms of what their primary goal is versus just a side effect.
Right. And what chromophore or pigment that we're targeting and intended to target.
Right, and that's where you said earlier, it's like, hey, it doesn't really target white hairs. It's like darker hair follicles on the skin is what it's going to target. It's that coloration.
Right.
Awesome. Somebody was asking, can laser hair removal target ingrown hairs?
Yeah, definitely. So even if that hair is trapped underneath the skin, the laser can still target it, which is nice. So I would recommend not digging at ingrown hairs, picking at it before your treatment. Just let the laser do its thing, and that way we can avoid all that irritation, potential infection afterwards and everything, and it'll eventually fall out as well.
Yeah, I think for all those different follicles, and that's the follicle essentially is the root of the hair, right? That's kind of where the connection of the body to the hair actually happens. Well, when the hair comes out, you leave the follicle, it leaves it empty. And so you don't really want anything to fill up in that space, any infection or anything like that. That's where you can get the inflammation, red dots, folliculitis, where that follicle
Scarring,
gets inflamed.
if you pick at it.
Scarring
Yeah.
as well for doing all those parts. And that's where we want to prevent all those things, make sure you're being hygienic in those areas and keeping it dry.
Cool. Somebody asked, what should I wear to my appointment?
Comfy clothes, wear something cool, probably not super tight fitting. I wouldn't like treat laser hair removal on your legs and then try to squeeze into some skinny jeans. Wear something comfortable and cool for afterwards.
Yeah, is there anything that people should not do the same day that get laser hair removal?
If you're gonna work out, do it before. Don't do that like afterwards. No hot tub saunas, no super hot steamy showers afterwards. So any of that you're gonna do, you can do it in the morning before your treatment. And then just do standard pre-care, make sure you shave and don't come in with a sunburn and all that good stuff.
And then this is another question I have is like, let's say I have an event in like 3 months, like got a wedding or an event to go to, whatever. Like, what's the right time frame that I should do this to make sure I'm good by the time to do that?
So depending on the body part again, but if we're treating say 6 sessions every say 8 weeks apart or something like that, what would that be? How long is that? Let's see.
So 6 sessions, 6 weeks apart, so that's like 36 weeks.
Yeah.
Right, so 36 weeks, it's quite a bit of time if you think about you're getting prepped and ready for doing this, and that's where the maintenance of this is super important, so you're not having to start from scratch again.
Right, and like we said though, with each session it is going to be finer, so you'll be having pretty good looking results towards the end of these sessions where it might be very fine hairs. You won't really be seeing that like follicle, if you know like strawberry skin and things like that, if you see like strawberry legs, that appearance gets less and less with each session also as the hairs get finer.
Yeah, so again, like that, 6 sessions over every 6 weeks, it's like 9 months, right? And so in terms of 9 months before, you gotta plan. It's
Right.
like planning a wedding.
Yeah, definitely.
Cool. Somebody said in the chat, I have PCOS. Will laser hair removal work for the hair on my face, even though it's hormonal?
Yeah, it does help to reduce the hair in the area, but back to the hormone thing, it's definitely going to be longer term. You're going to require more sessions of it, and it's probably never going to completely go away. You're not going to have results, as someone that doesn't have PCOS.
Yeah, I think you have to treat the underlying symptoms, right? And so it's like getting the PCOS regulated, whether you're using, different therapies, medications, or birth control, or anything like that. Then it will also, help control how fast that hair grows back, and therefore you're treating both things at the same time.
Definitely.
Awesome. Somebody had asked us, is it true that laser hair removal makes your skin smoother and brighter?
Yeah, absolutely. And especially this makes me think of dark areas. So if you shave your underarms all the time, you notice that hyperpigmentation. Once you don't have to constantly irritate those follicles shaving all the time, it does get noticeably brighter.
Cool. That kind of leads into the next question we had. Is laser hair removal safe to use over areas of hyperpigmentation?
It is, yes. It's safe for all skin types. So if you have that darkening on the underarm area or bikini area, it is still safe to treat over.
Cool. Somebody had asked, can you do laser while pregnant or breastfeeding? It was Gabby.
You can do laser while breastfeeding, but we do not treat any pregnant patients here at the plastic surgery.
Awesome. And then somebody wanted to know, how should I decide between laser hair removal, waxing, or electrolysis?
Depends on your goals, your budget, I guess. I like laser hair removal for the fact that I don't have to let my hair grow out in between sessions. That's really nice. Whereas waxing, you have to have a good bit of hair to be able to grip it and pull it out. But yeah.
Yeah, I think the other thing about electrolysis is electrolysis is mainly good for the people that have those white hairs or the hairs that have pigment, because it's a different way that they're removing the hair.
It's a bit more tedious also.
Yeah, it is more tedious and it is a little more painful.
Yeah.
Right, and so in terms of those things. But if that's what you have and that's what you're trying to remove, that's what that one's for. But in terms of the waxing, waxing is also colorblind, right, in terms of the hairs, but there is more irritation and can have more frequent, needs of waxing as well.
Awesome. And then our last question for both of you, what is something that you wish every patient knew before they did laser hair removal?
I think it's really important to know that it is safe on all skin types, because that was a common misconception for so long, that it wasn't safe on darker skin types, and now it is with our new technology. So yeah, that'd be my number one thing.
Yeah, and I think the key takeaway for laser hair removal is if you can get a treatment that you're not having to add maintenance into your daily routine, and it's just every 6 weeks, 6 months, or whatever treatment plan, it just spreads it out to just live your best life in terms of the other time. And I think that's the biggest thing I have takeaway.
Awesome, being high maintenance to be low maintenance.
Yeah,
Got it.
Yeah.
Awesome. Well, I think that's all of our questions.
Awesome.
All right, thanks for tuning in today for Lasers at With Plastic Surgery.